How is congenital scoliosis diagnosed, and what are the treatments? There are several main types of scoliosis, and we know that scoliosis ranges also widely in severity from mild to moderate to severe and very severe. And when we look at these different types, we know that types are definitely associated with causation. And the main types of scoliosis is something called idiopathic scoliosis, meaning the cause is unknown. This accounts for roughly about 80% of all known cases of scoliosis. The remaining 20% are associated with known causes, and this is neuromuscular scoliosis, degenerative scoliosis, and congenital scoliosis. So when we look at congenital scoliosis, it's when there's a malformed bone in the spine that develops in utero. And this malformed bone is a malformation with either one of the vertebral bodies or many. These vertebral bodies are the spine bones that form the entire spine. And spine bones are normally stacked upon each other, and they're typically rectangular in shape, making them like one brick on top of another brick. Well, if one of those vertebral bones have shapen differently, like into a triangle, it will now cause a curvature to occur at that area because the rest will be regular rectangles. And what makes this cause a curvature occur in that area, it can be because one bone it fails to form into a full vertebra called a hemivertebra, or it can be because some bones actually fuse together, causing the shape to be different, called a blocked vertebra. Either case, this is normally, if it happens in utero and the patient's born this way, it's a form of potential congenital scoliosis. Now, babies born with congenital scoliosis often have many other congenital anomalies, so there must be a comprehensive assessment done to make sure that there's no other systems that could have a congenital anomaly. Symptoms can include typically a highly visible curve at a very young age, asymmetrical shoulders, uneven hips, development of an unnatural rib arch or cage. Patients with congenital anomalies in the spine could also have asymmetrical rib numbers. They could have more ribs on one side than the other. And I've seen this in many cases where one side person could have maybe 10 ribs and the other side they have 12. So the rib cage looks very, very different. Left to right, the left sides and the right side of the backs are uneven, especially when they bend forward. Additional symptoms, unfortunately, in congenital scoliosis can be muscle spasticity in the lower body because it may affect the nerves. It could be malformed extremities like hand, feet, arm, really, really short neck or short torso because of the abnormal symmetry or development of the spine. Stiffness in certain movements, like if the abnormal vertebrae are in the neck, it could be stiffness in the neck, it could be hearing impairment. It can also be more severe things like bladder and kidney issues, and also a number of potential issues involving other bones and joints and muscles. So we know once there's a congenital diagnosis, a congenital anomaly within the spine, we have to look at many, many other things. Now, when we look at diagnosis, the first thing is normally a physical examination and taking a family history to see if there's any other spinal conditions that could be associated with congenital anomalies or any of the other congenital anomalies associated in the family. In most cases, the final diagnosis is typically done with an X-ray to see, okay, is there any abnormal shaped vertebra? And this is normally done to confirm not only the size of the angle where the scoliosis is located, but also the rotational elements that could be possibly existing within that scoliosis, how much twist is occurring. Also, many babies could be diagnosed with congenital scoliosis, and sometimes it's hard to get a good X-ray. So sometimes these are also done with either MRIs or CT scans. If there's a congenital anomaly that's discovered, normally they would follow this up to assess the spinal nerve system, the spinal cord and the nerves that exit, to make sure there's no deformities within these areas. So MRIs, even if it's done with an X-ray, MRIs are normally done to help look at these nerve structures. The spine normally forms somewhere around 8 to 12 weeks. So sometimes doctors can see some kind of congenital anomalies when they do ultrasounds, and sometimes they can see other systems that are developing. But other times, babies could be born with congenital scoliosis and not even know, and they goes unnoticed until they start to grow and develop. And then when they start to grow and develop, typically in adolescent, the curve could grow with them, and now it makes the curve more visible, and now they actually diagnose it. So there's a wide range of severity. Now, when we look at congenital scoliosis, there's some obvious challenges to treating congenital scoliosis due to two main things. the age of the diagnosis, most congenital scoliosis that we're finding at much younger in life, and also the severity of the deformity, meaning of the bones themselves. And these treatment options are typically specified based upon age, where the scoliosis is located, body type, and of course, severity and experience, the symptoms the person is experiencing. In mild cases, sometimes can just be monitored to see if the curves progress significantly. And if they don't, sometimes no treatment is performed. But unfortunately, congenital scoliosis is an atypical form, and it unfortunately can tend to progress more significantly because it's truly a bone deformity. And when we look at this, we can see an atypical presentation in the scoliosis, meaning instead of the spine bending typically left in the lumbar spine and right in the thoracic, we can see the opposite presentation, which can clue in. Also, the curves don't look smooth. They can sometimes be harsh and abrupt because of the asymmetry that's occurring in the vertebra. Normally, if we're going to treat a congenital scoliosis conservatively, normally we're combining a multimodal approach using chiropractic care, passive and active physical therapy in the office. We're also using corrective bracing, and we're also using home therapy and rehab. In severe cases of congenital scoliosis, some may require surgical intervention because the asymmetry of the vertebrae are so severe, meaning the congenital ones, that it's accounting for the full size of the curvature, and we can't alter that abnormal shaped vertebra. We can alter what gets acquired after the fact. So here at the center, we have treated congenital scoliosis successfully with our type of treatment, but we always have to modify it, really trying to figure out what works best for that patient based upon their age and severity. It's very important for parents and caregivers to understand that sometimes babies born with congenital scoliosis can very often have additional anomalies, so therefore they must be assessed properly. Thanks for watching. I hope you found this information helpful. If you'd like to hear about other topics and information on scoliosis, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish content. Thanks.